The first thing I'd like to say about Ramadan and fasting in pregnancy is you need to consult with your gynecologist, first of all.
Okay.
Why? Because we have sometimes high-risk pregnancies, and a high-risk pregnancy is categorized as a pregnancy where you have other illnesses like diabetes, hypertension, or even if you're carrying twins or even triplets. Okay. Your needs are different. You're taking medication, you have different nutritional needs. So for that group of people, we would say they would need to abstain from fasting.
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to another episode of Stay Healthy. I'm your host, Mariam Salim. On our show today, we're going to address the issue of pregnancy and Ramadan. Help me to unpack on this is Dr. Susan Adongo from AAR. Daktari, welcome to the show and kindly introduce yourself.
Thank you, Mariam. My name is Dr. Susan Adongo Meme. I'm an obstetrician gynecologist currently practicing at the AAR City Center Clinic.
Before we start,
yes,
obstetrician, kindly tell us what it's all about.
An obstetrician gynecologist is a specialist or a consultant doctor who deals in women's health. So we cover all the way from pregnancy to women's reproductive health, menstrual issues, basically anything that affects a woman's life, all the way from actually all far as back as birth, adolescence, through pregnancy, through menopause. Yes.
Okay, now let's dive in, Dr. Kindly enlighten us the signs of pregnancy during the first stages.
All right. So some of the most obvious sign of pregnancy is a missed period. Of course, when you miss your period, then more often than not, you are likely to be pregnant. But you also have other signs like swelling of the breasts, tenderness of the breasts. 80% of women who are pregnant have nausea and vomiting, so that's a sign as well. You might have change in the smell, change in the taste, so your sense of smell and taste become heightened. You have increased vaginal discharge. Yes, you can have increased urination. Those are all signs of pregnancy. But I'd have to say that not everyone gets them. A majority of women get them, but there's a small percentage of women who actually have no symptoms and signs except maybe a missed period.
So they vary from woman to woman?
Yes.
Okay. Now, let's talk about the stages of pregnancy. To my understanding, there are 3 of them, the 3 trimesters.
Yes.
Let's talk about that.
It's interesting you say that. Actually, now we have even a 4th one. I'll tell you about it. Yes, yes.
Let us know.
So we have 3 trimesters of pregnancy, the first, the second, and the third. And the first is about from the first week to 13 weeks. Then the second trimester from 14 to about 27. And then the third from 28 to 40. Okay. Now we talk about the 4th trimester. It's not a scientific term, but we say it's after the baby is born. And it's the reason why we still talk about it is because some of the symptoms of pregnancy still carry forth into that period. Okay.
Is it due to the hormones that are still fluctuating or what?
Yes, in the body, because it takes time. It doesn't mean that immediately you deliver, your hormonal levels all just go down. It takes time for the hormones to still go down, to regulate, and others that were not there now start rising. So you still have carry-on symptoms even in that period. So we still come in that period. We don't now say, okay, you've delivered, now we're done with you. Yeah.
Now, to my understanding, you mentioned something about with hormones.
Yes.
Let's talk of the postpartum depression that happens after women give birth. Most women, due to the fluctuation of the hormones, they go through the many changes.
Yes.
Kindly enlighten us on that.
Okay, so we have postpartum depression and we also have postpartum blues. We have to they are two different things.
Okay.
So other than the change in hormones, there are some women who are more likely to have postpartum depression than others. It doesn't happen to everyone, just about 1% of the population.
Why is it so?
It can happen due to the drastic change in hormones. Some hormones go up, like progesterone, which was high during pregnancy, dips. But women who do not have a good social support, women who are single, women who it's their first delivery are more prone to getting postpartum depression. As for postpartum blues, 80% of women actually get them. And it's when you're pregnant, you've delivered, it's a new environment, a lot of crying, a lot of sleepless nights.
Especially exactly at night. I wanted to mention that.
Yeah, so you're not sleeping well, your child is crying. This child is fully dependent on you. No matter what, nobody can tell you, let me take this child away for the next 48 hours. And so it affects a large number of women. And people actually don't know that. You find a new mother is really crying. She doesn't know what to do. Her
you become
nipples are
anxious.
cracking. Yeah, you're anxious. You're not sleeping. You can barely eat. You're not showering. Your life has changed.
Not showering. Isn't that extreme, Dr.
No, it happens
Really?
actually, because remember the feeling of this small, tiny human being is your first time. Most people feel that if I leave this child for a second, something might happen.
Very true.
So
Very
you want
true.
to be with that child all the time. You barely have time for yourself. Remember, you're even being told you have to pump milk. You're being told you have to take, like 3 to 4 thermoses of water.
Uji. By the way, talking about the uji, I'll ask you later on. Continue.
Yes. And so all that stress comes together giving you postpartum blues. But postpartum blues usually lasts about 3 days to 15 days. Now, by that time, now social support has come in, people are there helping you. If now it goes beyond a month, beyond 2 months, you start having negative feelings towards your child, a lot of mood swings, then now we start thinking of postpartum depression. And it is something that you must be seen by a psychiatrist, and more often than not actually requires treatment.
Okay.
Yes.
Now, earlier when we talked about the drinking of more water and the uji, the myth that for a new mother to produce enough milk for the baby, you have to take more porridge and the black peas, if I'm not mistaken. Kindly, is it true, Dr.
It's more of a myth, honestly. We say any fluid that you take. So the normal adult, you and I, who are not pregnant, hopefully, we are supposed to take 8 glasses of water a day. Okay. Now for someone who is breastfeeding, they're supposed to take 16, double of that. But it doesn't have to be uji. It can be any fluid. It can be your cocoa, it can be your tea, it can
even
be
juice.
Well, juice we stay away from, maybe because of the issue of acidity, right? But if it's fresh juice that has been blended, then there's no problem with that. There's dill seeds, when you boil them, fennel seeds, all these things, fenugreek, they're all in the market. The issue is you have to keep drinking, right? Yes.
Now, Dr. Since we are in the month of Ramadan, let's talk about fasting. Is it safe for a pregnant woman to fast?
Okay. I would not like to use the word safe or not safe. The first thing I would like to say about Ramadan and fasting in pregnancy is you need to consult with your gynecologist, first of all.
Okay.
Why? Because we have sometimes high-risk pregnancies, and a high-risk pregnancy is categorized as a pregnancy where you have other illnesses like diabetes, hypertension, or even if you're carrying twins or even triplets. Okay. Your needs are different. You're taking medication, you have different nutritional needs. So for that group of people, we would say they would need to abstain from fasting. But if your gynecologist assesses you and sees that the baby is growing well, the mother is healthy, she has no other issues, then there's no reason why you should not fast. However, there is a but to this. One, we would not advise you to fast for more than at maximum 12 hours. So we say 10 to 12 hours. And then for a pregnant lady, if and when you break the fast, don't go immediately into taking a big meal, because you will struggle with issues of constipation and you might even vomit. So we say first start by hydrating. Take your soup, take your bowl of fruit, okay? Some high fiber meals. And even as they're eating, take things like lentils, beans, whole grain foods, which will make you stay full for long and which stay in the stomach for longer. And the same thing in the morning, can wake up early. Instead of just taking a simple breakfast, take a proper meal. Same thing, which is high in fiber. We can say in the first trimester is the trickiest time, okay? Because it's the time when the hormones are just beginning to regulate, okay? And so during that period, we can say you can do alternate day fasting. You don't have to fast every day. And as a pregnant woman, even when you're fasting and you begin to feel lightheaded, you begin to feel dizzy, I think you can step away, take a break, and then try again the following day. Yes.
Islam exempt to pregnant women from fasting, just like you put it, unless they're in good health and they are capable of fasting. Now let's talk about the challenges that pregnant women go through during their pregnancy period.
All right. The challenges are very different, right? And they vary from different trimester to trimester. In the first trimester, like I mentioned earlier, the biggest challenge is usually nausea and vomiting. And I said about 80% of pregnant women go through that. So you're having nausea, you're vomiting, you can't retain anything. Another big challenge that people complain about in the first trimester is fatigue and excessive sleep.
Yeah, true. You feel tired most of the time.
Yeah, you feel tired most of the time. And now because of this heightened smell, all right, something which was smelling normally yesterday, today you cannot stand the smell. Some cannot stand the smell of their own, perfume, roll-on, they cannot, or even of their partner. Right? So it becomes a challenge. Food which was previously smelling okay now has a problem. Another big challenge in the first trimester is change of taste. You begin to get a metallic taste. So everything tastes the same. What does that come with? It comes with loss of appetite. So the first trimester is one of the most challenging for women. If you're able to go through that, and actually, some people get it so bad, they even get depressed. Because you're not able to eat, you have a lost appetite, you're even wondering, this pregnancy is, how will I even get to the end? Yeah, so that's one of the hardest trimesters, if I can say. The second trimester, people say, is the best. Your nausea, more often than not, and vomiting has gone away.
You're now on vacation.
Your energy levels are up. You're beginning to notice the bump. People get excited. You're now dressing up your body.
They glow up.
Yeah, you glow. So the second trimester, usually we don't get any issues. It's usually a smooth run until now we get to the third trimester. Now you're heavy. So now the fatigue that you had comes back because of the excessive weight and fluid in the body. Your legs begin to swell, right? So you cannot put on your regular shoes. Some people, they swell so much they have to wear Crocs and slippers to walk about. And then the lack of sleep begins. Sometimes you say maybe it's God just, taking away the sleep in preparation for when the baby
what
comes.
What is coming next, exactly.
What is coming next. So you're not able to sleep well. Turning in bed becomes hard. That is when people just cannot wait for the baby to come. Those are some of the challenges. Yeah,
you mentioned something about the husband now. Let's talk about the role of the husband during the pregnancy period.
Very interesting. One of the most important things I believe a pregnant woman needs is support and encouragement from the partner, right? We see a lot of women coming by themselves to the clinic, and we usually really encourage husbands to come with their wives to the clinic so that they can also be part of this journey to be able to understand, what is this that my wife is going through? What is this that my partner is going through? Sometimes you're pregnant, your belly is here, you want even to just cut your nails, you can't bend, you want to lift something, you can't even reach your feet even when you're showering or washing. So those are the things that we encourage husbands to understand. Another thing, sometimes we have some certain complications in pregnancy which require us to tell couples to abstain. So you can imagine abstaining for 9 months. And when you tell the wives to go home and tell their husbands, it becomes a very big problem. So back to my point of husbands coming to the clinic with their wives, for us to be able to explain to them that because of this condition, you cannot be able to continue in this way. Help your wife even if she's vomiting. For some of them, if you have no one to help, your husband might be forced to go to the kitchen and cook because your wife cannot cook. She can't smell onions, she can't smell garlic, she's vomiting, So the husband will have to take up that role, to step in and say, okay, I'll have to go to the kitchen for this period and prepare a meal for us. So biggest role a husband plays support and encouragement.
Okay.
Yes.
Now, just like Dr. has put it, that men play a big role during the pregnancy period. They should step up their game by being supportive during that moment. Let's take a fast break and come back. We'll take it from there. Stay tuned. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Stay Healthy. This is the second part and the last one of the show. If you're joining us, we're talking about pregnancy and Ramadan. Daktari, before we went for the break, we're talking about the roles of husband during the pregnancy period. Now, let's talk about the supplement that you are advised to take once you start your clinical sessions. The folic and the iron. What role do they play during the pregnancy?
Okay. So I'll start with folic acid.
Yeah.
Folic acid actually should be started before you get pregnant.
Okay.
There's this something we call preconception care. So if you're trying for pregnancy or you are thinking of even getting pregnant, you should accompany those thoughts with folic acid.
But sometimes you didn't plan it and it just happened.
Yeah.
So maybe is there like a disadvantage if you didn't take the folic before you conceived?
No, I wouldn't say there's a disadvantage. It's just good to start before. But even if you don't and you get pregnant, immediately that second line appears on that pregnancy test. The first thing you should take is folic acid. And the good thing is it's available all over. You don't need to get a prescription from a doctor. You can just go to a pharmacy and buy folic acid. Readily available. It's about 1 bob a tablet or up to 5 bob a tablet. It's very important. The reason why it's important is because it helps in development of the brain and the spinal cord of the baby. Okay. And I have to emphasize that is the reason why we encourage people to see your gynecologist the moment you get pregnant for your folic acid, right? And it's taken throughout up to the end of the first trimester. There are certain people who will require them to take the whole pregnancy. If you're diabetic, you'll need to take folic acid. If you're HIV positive, or if you delivered a baby with a brain or spinal cord abnormality previously, then your future pregnancies will give you folic acid throughout and at a higher dose. Okay? For your iron, we don't start immediately. We usually start after the first trimester. Reason being because iron actually gives a more nausea. So we do not want to give you iron just to increase your nausea and vomiting. We like to start it in the second trimester all the way through up to breastfeeding. Why is it important?
Oh, until breastfeeding. Most people assume that once I give birth, I'm done with the supplements.
Yes, that is an assumption, but actually it's incorrect. It should be taken even after because it nourishes the breast milk and the baby, remember, is getting the iron through that breast milk, right? And the baby is only taking your breast milk, right? So that's why we give it all the way even up to our fourth. Remember the fourth trimester?
The fourth we mentioned earlier.
Yes, up to when the baby is 3 months, you should continue taking your iron supplements. Remember, even when you deliver, you lose a lot of blood. Okay. That blood needs to be replaced through your diet and through your iron supplements. There's one that I need also to mention, calcium.
Yeah.
Very important, yes. Calcium we also start in the second trimester and continue, especially in the third trimester. You'll hear a woman saying, oh, I'm having muscle aches. I am having muscle pulls.
Isn't it due to maybe the heaviness of the stomach since it has grown and protruded?
That is also true, but remember the muscles that are even holding up your abdomen, what do they need? They need calcium.
Okay.
Yes, so we have to supplement calcium. And remember, even when you're breastfeeding, you're losing that calcium. You'll hear a pregnant woman saying, my teeth are now aching. I'm having toothaches. I'm having joint aches. It's because of low calcium. So even with iron, they take calcium all the way. As long as they're breastfeeding, they must be taking their calcium. Yes, very important.
There's something I remember that once you're pregnant, people start saying that, oh, you're glowing, yeah, you look beautiful. Let's talk about that. Is it due to the supplement or maybe the hormones or what?
No, I don't think it's due to the supplements. I think maybe it's just because of the hormonal changes. This hormone called progesterone is the one which increases.
So it is the friendly one.
It's the friendly hormone. But also the lazy hormone.
Oh, okay.
Because it is responsible for the excessive sleep in the first trimester, and it also contributes to constipation in pregnancy. You always hear a pregnant woman saying, I have constipation or I'm having a lot of heartburn. This is because of progesterone. When it comes into your body, it causes everything to slow down. So even when you eat, your digestion is much slower, and that causes a lot of constipation and also causes a lot of heartburn. Your
digestion is slower.
Yes.
And to my understanding, when you're pregnant, you're hungry most of the time and you're eating a lot. Yeah, talking about eating a lot, Dr.
Yes.
People assume that when you're pregnant, you should eat for two. Yeah, let's talk about that and the weight gain during the pregnancy, the whole process of it.
Okay. That's actually a myth. I know people say you should eat for two, but it's not true. Eating for two means you're eating double. You mean if you're eating one pizza before, now you should be eating two? No, that is actually not healthy. Actually, in the first and second trimester of pregnancy, your needs, your nutritional needs are actually the same as anyone who is not pregnant. It's in the third trimester that you need slightly more calories than somebody who is not pregnant. So we don't necessarily say eat for two. We say eat a balanced diet. That is a must. And a balanced diet, I mean you have to eat your carbohydrates. Carbohydrates give you energy. You have to eat your proteins, bodybuilding foods, because you're also building another human being inside of you. You have to eat your fruits and your vegetables because of the issues of constipation that I've just spoken about.
Yeah, true.
You have to eat your fats. People run away from fats thinking, oh, fats will make me fat. No, we have healthy fats. Yeah, avocado, omega-3, which help in development of the brain and the spinal cord of the baby. And key to all this is hydration. Hydrate, hydrate, hydrate. In fact, pregnant women should be those ones who are carrying bottles around, always hydrating. But now you have to eat these meals. Instead of eating for two, you eat like what we say like a baby. Small, frequent meals. So every 3 hours, a pregnant woman should be eating. Should have an apple always in your bag, ground nuts always walking around. We have no problem with that, other than taking one huge meal.
Big ugali. You mentioned something about nutrition and constipation. But before we go to that, let's talk about the chores. Since especially we are in the month of Ramadan, most household, we cook a lot because we are inviting people over. So let's talk about the impact to a pregnant woman, all those chores.
It's important you say that. Still on the nutrition and the chores that you're having. Of course, if you're more active, your body will require more energy. If your body requires more energy, you will become more hungry. Okay, so we say in the month of Ramadan for pregnant women, they should actually reduce their activity levels. If you are somebody who was already exercising a lot, if you're fasting, you need to reduce, because if you increase your energy levels by doing several chores, you're walking around, you're doing house chores, you're going upstairs, you're coming downstairs, you'll become hungry faster. And if you're fasting, then your blood sugar will go down and you'll become, you'll start becoming dizzy, you might lose consciousness. So we say reduce your chores, reduce your activity if you are actually fasting and you're pregnant.
Okay.
Yes.
For example, you mentioned earlier of the constipation. Most women undergo constipation during their pregnancy. Now, let's address that. How can they deal with it?
Okay. As we said before, the constipation is due to this hormone called progesterone that slows down everything. So the digestion is slightly slower and a lot of water is taken out of your gut. That's why you end up with constipation, right? We say one of the ways to deal with constipation is to eat small, frequent meals. Don't take a big ugali and a lot of meat and a lot of skuma because already your body has slowed down. If you take a big meal, a lot of water will be absorbed out of that meal and you'll become constipated. So small, frequent meals. Then your meals must have vegetables. Lots of vegetables, whether it's vegetable salad or cooked vegetables, very important because of roughage.
When you say vegetable, does it have to be green or maybe cabbage?
No, even cabbage is good because of the roughage, right? And then fruits always is very important because of the water content in the fruit, and because even fruits themselves give roughage. So fruits like watermelon, of course, if you're able to stay away from foods that cause acidity, because pregnancy also comes with heartburn. So watermelon actually would be the best. Take lots and lots of fruits. That will help with the constipation. When it gets really bad, then that's when we give medication for it. And of course, water.
A lot of it.
A lot
drink.
of water. Yeah.
Okay, nutrition. You mentioned something about a balanced diet. Now, what is the role of nutrition when it comes to pregnancy women? And especially if, for example, if somebody is fasting and they'll break up the fast and they have to eat maybe like for a few hours before they go to bed. Now, okay, what kind of food can they take that will be beneficial to them and the unborn child?
When you're fasting, it's important when you break your fast immediately, you start by hydrating first and foremost, okay? So possibly take your glass of water with a slice of lemon or a whole, like even a whole liter of water. If you can't take the water, you take soup, okay?
Soup?
Yes.
Any kind of soup?
Any kind of soup, all right? Just to break the fast so that we now go into the meals. Now, when it goes to the meals, because you have to sleep, of course, you can't stay awake eating the whole night. We advise that you take meals that are high in fiber. Fiber meaning it will stay in the stomach for much longer, yeah, and give nutrition to your growing child. Meals that are high in fiber are the whole grain, like whole grain bread, brown rice, brown chapati, beans, lentils. Those are the things that stay in the stomach longer. Those are the ones which we advise the pregnant woman to take. And we also advise that even in the morning for breakfast to take a proper meal. Same thing, which is high in fiber and to really hydrate. And then to always keep a balanced diet. Make sure the plate, you know, there's a way we draw our plates and then we divide the plate. The plate should always have a carbohydrate, a protein, vegetable, and don't forget your healthy fats.
Okay.
Yes, so your avocado would be good at that point. Your nuts would be good. Your seeds, pumpkin seeds. You know, we talk about pumpkin seeds, chia seeds.
Yeah.
People wonder what are those. Those are good whole grain foods and very good for digestion.
Okay.
Yes.
Now let's talk about working out, especially for pregnant women. For example, somebody was working out before conceiving and after conceiving. Should they continue with the workout routine? And if so, what kind of workout should they do and what not to do?
Okay, that's a good question. If somebody was already working out, then by all means, it is good for them to continue. It is safe for them to continue. It's not, most people say, oh, I'm pregnant, I want to lose weight. You were never working out before pregnancy. Then when you get pregnant, now you just want to start working out. That would be, that would not be advisable. I even know of a lady who is a gym instructor. She got pregnant and she worked out throughout her pregnancy.
So it's safe to work out when you're pregnant?
It is safe to work out. However, some things are not advisable. For example, doing floor work, like doing sit-ups, is not allowed because of the issue around the pelvic area. Doing press-ups. So floor work is not really advised. What we advise is swimming is a very good workout, by the way, for pregnancy. All form of swimming. Light jogging, so not heavy, you don't do heavy workouts.
Yeah.
Okay. Don't do things that have sudden movements, like skipping. We don't advise. Jumping excessively, we also don't advise. But you can actually lift weights. If you are lifting weights before you are pregnant, it's actually safe to also lift those weights, right? You can maintain the same weight that you are lifting and not go too heavy on yourself. So working out is safe. Working out is good. It helps with your circulation. It helps with your sleep. Remember, pregnancy also comes with reduced sleep, so it helps with your sleep. So we encourage it. Yes.
Now, Daktari, before we conclude, any advice to the pregnant women who are watching you right now?
Okay. Pregnancy is a good thing, right? It's a natural thing. We say in the medical world, pregnancy is not an illness. However, it can come with its complications. The most important thing I'd like to emphasize is the importance of antenatal care. When you get pregnant, immediately go and see a gynecologist. Get a gynecologist, somebody you can trust and identify with, and start seeing them. But more importantly, even as women of childbearing age, meaning a woman who has started her periods, you should still have a gynecologist. Don't wait to get pregnant to see a gynecologist. Start early, start before. Go and see your gynecologist, get checked, do your pap smear. Let's talk about your menses. Let's talk about contraceptive if it's acceptable. Let's optimize your body before you start getting to the place of getting pregnant. And then let's walk the journey together. Yes, and I think everything should be okay.
Okay.
Yes.
Daktari, thank you so much for the insightful discussion.
Thank you.
Indeed, I've really enjoyed it.
Thank you for having me.
You're most welcome.
All
well,
right.
I hope you also enjoyed the discussion. That marks the end of the show today. Join us next week for another interesting topic. On behalf of my production team, Mr. Mohammed Shakombo, Mr. Ayub, and also Sister Saida, I've been your host, Mariam Salim. Till we meet again, ma'asalam.